Harm reduction is defined as interventions aimed to help people avoid negative effects of substance use or geared towards reducing the harm attached to substance use. When we think about harm, that might be harm to the physical body, like an overdose or infectious diseases, harm to the emotional self, like guilt and shame, and harm to the spiritual self, like loss of purpose or disconnectedness. Harm reduction is not a new concept and has been around in the United States since at least the 1960s, but still carries a stigma with it and still comes across as a radical concept, and in some places, various forms of it are still illegal. Many people understand harm reduction as a way to meet people where they are with kindness and respect. As counselors, it's our job to practice empathy and unconditional positive regard. Harm reduction is one way to do this with clients who are using substances. Understanding and practicing harm reduction can enhance a counselor's ability to support clients holistically, addressing not only substance use, but also broader issues of well-being and self-worth. By incorporating harm reduction strategies, counselors can better advocate for their clients' needs and contribute to a more compassionate and effective approach to care. My objectives for this training include knowledge acquisition to enhance participants' understanding and knowledge of harm reduction principles, strategies, and their application in substance use treatment, equipping them with the skills and insights needed to implement effective harm reduction programs. Awareness building to raise awareness among participants about the importance, effectiveness, and necessity of harm reduction strategies in addressing substance use, fostering a compassionate and informed perspective that supports the health and dignity of individuals who use substances. I'll do this through clarifying the definition and core principles of harm reduction and explaining the ethical and human rights foundations of harm reduction. And finally, communication and support to enhance participants' communication skills and their ability to provide effective and compassionate support for individuals engaged in harm reduction practices using a collaborative and empathetic approach that encourages positive health outcomes. Hi, I'm Jen Ackerson. I'm a doctoral candidate at Waynesburg University studying counselor education and supervision. I've been working in substance use treatment for over 10 years, and I'm the clinical supervisor of an outpatient treatment center in Pittsburgh, Pennsylvania. While I work primarily with clients who have substance use disorders and help teach and train counselors working in the field of addictions, I've noticed how many mental health counselors don't often have training in addiction, much less harm reduction principles. It's my hope to bridge this gap by providing education and resources that will inspire counselors to incorporate harm reduction strategies into their practice. Chances are, whether your focus is on addiction counseling or mental health counseling, you will encounter a client who uses substances. Being prepared for a compassionate approach to treatment is essential. So let's start with defining harm reduction. We can look at it broadly as a philosophical and political movement, as well as a community movement that aims to reduce the harm associated with substance use. Harm reduction utilizes a spectrum of strategies to reduce the negative consequences associated with substance use, sex work, and other behaviors that often coincide with substance use. As counselors, we are great with recognizing that most often people are making the best choices they can with the tools and resources that they have at available time. Substance use is no different. Working with people who use drugs requires respect for the choice of people with whom you're working. It may not be the best choice, it may not be the choice you would make, and it may appear there are other resources available to them, but it's essential that you respect the choices of the person as their right. Harm reduction believes in each individual's capacity for self-determination and self-governance. We know it doesn't work when we tell people how and when to change, nor is that our job. We are here to support, uplift, validate, and be a witness to people's process. And some of the historical context and evolution of harm reduction finds its roots and inspiration across multiple movements and strategies emerging across the United States in the 1960s, 1970s, and 1980s. Starting with the Black Panther Party's survival programs such as free breakfast for children and health clinics, the Young Lords' launch of an acupuncture program for heroin users in the South Bronx, the women's health movement emerged from the 1970s feminist activism and the fight for reproductive health, and grassroots and activist response to the AIDS crisis in the 1980s and beyond. The roots of harm reduction as a movement are in questioning and challenging the status quo, injustices, and oppression. Consider how racism, stigma, and criminalization cause harm. Part of the harm reduction movement must also be rooted in social justice. It can't be only focused on public health. Between 1999 and 2022, the Black overdose death rate increased more than sixfold, and those numbers have continued to increase. Why? Black people often have difficulty accessing medications for opioid use disorder. They may have limited access to harm reduction education, tools, and supplies, and they face racist drug law enforcement that disproportionately targets them. They have a 6 times higher rate of incarceration for drug charges in the United States, despite the same rate of substance use as other races. They experience mistreatment and stigma in healthcare settings. Ending inequality and oppression and fostering health and liberation are all parts of the larger harm reduction principles. Providing harm reduction services requires a willingness to practice radical neutrality, grapple with ethical gray areas, tolerate, accept, and understand difficult behaviors, be taught by our clients, relinquish the role of authority, judge, or expert, and to partner with our clients. And that was said by Pat Denning and Jeannie Little, who are co-founders of the Center for Harm Reduction Therapy. Services associated with harm reduction are often seen as syringe service programs, overdose prevention and education, medication-assisted treatment, wound care clinics, peer navigation, and maintenance support groups. And when we think about harm reduction on a bigger level outside of substance use examples, wearing a seatbelt when you get into a car is an example of harm reduction. Practicing heart health by making sure you eat your vegetables, drink water, and get enough exercise is harm reduction. And a very common example of harm reduction is smoking cessation classes or nicotine patches and gum. So you may already be practicing harm reduction with your clients and not even know. So under the umbrella of harm reduction, you'll find multiple theories or approaches like safer techniques, managed use, and abstinence. Safer techniques, this might include safe consumption sites where clean injection supplies are offered, where people are monitored for overdose. There are trainings for people to better understand their bodies, what veins to shoot into, which ones to avoid, and how to make sure that they're sterilizing their works before use. Needle exchange programs, overdose prevention tactics like encouraging people to carry naloxone and to never use alone, safe sex materials, making sure that people have safe and clean, affordable housing. This will also aim to lessen harms associated with drug use and related behaviors that increase the risk of infectious diseases, including HIV, viral hepatitis, and bacterial and fungal infections. As far as managed use goes, this might include medication-assisted treatment like methadone, buprenorphine, Suboxone Sublocade, drop-in centers, accessing treatment with the goal to cut back on substance use or stop using with a needle. A harm reduction approach acknowledges that not all individuals are ready or able to achieve total abstinence and instead seeks to reduce harm, enhances safety, and supports incremental positive changes in their behavior and health. And abstinence also falls under the umbrella of harm reduction. Abstinence-based models emphasize complete cessation of substance use as the primary goal of treatment. These programs often involve structured support through detoxification programs, residential treatment, and operate on the belief that any level of substance use is harmful and that full recovery can only be achieved through total abstinence. While this method can be highly effective for some individuals, it may not be suitable for everyone, particularly those who struggle with repeated relapse or are not ready to fully commit to abstinence. Abstinence does fit under the harm reduction umbrella as any behavior geared towards reducing harm is included, and stopping substance use entirely is definitely a way to reduce harm. Resources for abstinence would be inpatient and outpatient treatment centers, antagonist medications like Vivitrol or naltrexone, sober support meetings like 12-step-based Alcoholics Anonymous, Narcotics Anonymous, and so many more. Consequently, harm reduction and abstinence-based models can be seen as complementary approaches, each offering unique benefits and support mechanisms tailored to the diverse needs of individuals with substance use disorders. Harm reduction is an evidence-based approach that is critical to engaging with people who use drugs and equipping them with life-saving tools and information to create positive change in their lives and potentially save their lives. Working in substance use treatment for so long, we always say that we can help. We can work with a client about anything in their life so long as they're not dead. When a client dies from substance use, there's nothing left for us to do. So we can look at, first and foremost, the goal of treatment and harm reduction being to keep that person alive. So as long as they are alive, they can build motivation to create changes in their life that will support their goals. The United States is experiencing the most significant substance use and overdose epidemic it has ever faced, exacerbated by the recent worldwide pandemic and driven by the spread of highly potent synthetic opioids containing fentanyl or fentanyl analogs and animal tranquilizers like xylazine into types of drugs including stimulants and counterfeit prescription pills or pressed pills. There were more than 100,000 drug-involved overdose deaths in 2023. All overdose deaths are preventable. Harm reduction offers an opportunity to reach people who aren't otherwise accessing healthcare services and offer them naloxone to reverse overdose and help connect them to other needed services. As an example, treatment services such as medications for opioid use disorder can be co-located with harm reduction services and offered as an option. This potential connection to treatment is critical when the data shows that only around 1 out of 10 people with a substance use disorder have received treatment. Harm reduction organizations can fill that gap by providing services that people do feel they need in order to make positive change. Harm reduction services save lives by being available and accessible in a manner that emphasizes the need for humility and compassion towards people who use drugs. Harm reduction plays a significant role in preventing drug-related deaths and increasing access to healthcare, social services, and treatment. These services decrease overdose fatalities, acute life-threatening infections related to unsterile drug injection, and chronic diseases like HIV and hepatitis C. So when we talk about the benefits of harm reduction, we'll start with cost savings. Harm reduction has been found throughout research to be a cost-effective way, with the unit cost of interventions being relatively low. Studies in numerous countries have reportedly provided compelling evidence that syringe access programs for those injecting drugs are cost-effective from both societal and healthcare perspectives, and the net financial benefits translate across diverse regions, economic settings. In working to prevent the spread of HIV and AIDS, harm reduction significantly saves communities financially compared to the lifetime costs associated with antiretroviral treatment for the condition. A recent study in Australia found that syringe access had a $1.3 to $5.5 return on every $1 invested. Another benefit comes from when we're looking at the spread of disease. Substance use is tied to risky behaviors such as needle sharing, unprotected sex, and contributes to the weakening of the human immune system, putting individuals with substance use disorder at greater risk for contracting HIV, hepatitis, and other infectious diseases. Intravenous drug use or injection is responsible for 33% of adolescent adult HIV cases and more than 50% of cases at birth. Harm reduction programs have shown to lower HIV risk and hepatitis transmission. Syringe access programs have consistently been shown to substantially reduce the rate of HIV transmission among people who inject drugs without actually increasing rates of drug use. Safer consumption spaces have been shown to decrease disease transmission as well. And when considering treatment referral and initiation, harm reduction programs have been shown to provide a gateway to addiction treatment programs, offering non-judgmental information and assistance. In 2005, more than 85% of 160 syringe access programs in the United States regularly made treatment referrals. Syringe access is known to reduce drug use, with participating individuals 5 times more likely to enter addiction treatment and overall increasing rates of reducing or stopping intravenous drug usage. And regarding overdose prevention, harm reduction programs have been shown to prevent overdose. The training and provision of overdose reversal medication naloxone, also known as Narcan, and the presence of medical staff at safe injection spaces have greatly reduced incidences of fatal overdose. Lastly, we can talk about community safety and contamination prevention. By providing safe disposal of injection equipment, harm reduction programs reduce improper syringe disposal, which reduces the number of contaminated syringes circulating in the community and protects emergency response and public safety officers from accidental needle stick injuries. Safe consumption spaces have also been found to reduce public disorder and public drug use within communities. In one study, 90% of individuals accessing a safe consumption space reported that they would have been injecting in a public restroom, street, park, or parking lot if not at the facility, with a 67% reporting recent unsafe disposal of used drug equipment. It was estimated that across a 2-year period, this one facility alone prevented over 2,000 incidences of public drug use and over 1,700 syringes from being improperly disposed of in public spaces. Misconceptions include that harm reduction strategies and programs might enable illicit drug use, condone illicit drug use, or have a not in my backyard attitude that fear harm reduction programs will increase substance use and crime in the surrounding communities, although this fear is not supported by research. And like I mentioned the seatbelt before, examples of harm reduction in other areas include birth control pills, cigarette filters, speed limit stop signs, traffic signals. None of this is condoning driving fast or recklessly, but it's aimed at protecting those who do from dying and those who don't from others who choose to drive recklessly. Sunscreen is also a great example. If you didn't want to get sunburn or risk skin cancer, you could choose the abstinence model of staying inside all the time. But realistically, we know that's not possible or very much fun. So we can choose to participate in using sunscreen or to reduce our harm. And I'm sure that you can think of even more examples in our daily lives that's harm reduction. The aim here is not to condone or enable, but rather to make the behavior safer when people do choose to engage in them. Death does not motivate people to change. We have to make sure that we're keeping people alive if we want to be of any assistance at all. And when we think about the challenges and criticisms of the model, I think it often boils down to people not having a great understanding of empathetic and compassionate care for others. So, what can you do? Your words matter. Try to use person first language. People are more than their behavior, and harm reduction focuses on the whole person. Everyone is a person first, and behavior can be changed. Using words like addict or user implies that the person is something instead of someone. Stigma is a real barrier to care, and people who use drugs must feel safe and welcome to access services. And consider substance use on a continuum. It goes far beyond abstinent or user, and there are many stops between. Notice the descriptions below that are non stigmatizing and don't aim to label or increase guilt. Take an inventory of your practice and consider ways that you can incorporate harm reduction resources into your treatment. What does your screening process for substance use look like? How often do you explore substance use in session? What do your reactions look like? Are they stigmatizing? Are they enabling? Or are they open to the client's experiences? You can also go get trained on overdose awareness and reversal. Naloxone can certainly be considered harm reduction strategies that everybody should be trained on. And if you would get trained on CPR, getting trained on opioid overdose reversal is no different. Consider your agency or social groups that you're a part of. One of the best ways to practice harm reduction in your immediate community is to think about your work sponsored happy hours or the drinking events that you might be used to planning with your friends. To make harm reduction and abstinence efforts more socially accessible and accepted, try to plan events that don't revolve around drinking. Normalize spending time with others without using substances. Rework the happy hour culture at your workplace. Instead of assuming everyone drinks, what might it be like to assume that no one does? You can check out the resources page for more ways to get involved and look for resources local to you for ways to reduce harm in your community. I'm hoping that I was able to build your knowledge about harm reduction, increase your awareness about the importance, effectiveness, and necessity of harm reduction strategies in our community, help you identify stigma or the bias that you're carrying about the topic, and give you resources to help grow and challenge yourself to incorporate harm reduction strategies. The following slides are resources you can access. Use the PDF attached below for clickable links.